neck issues. Now, yes, the answer is it can be caused by neck issues. However, we are going to talk about the scenario in which this is possible and then the scenario in which it is not possible. Now, before we get into the topic for today, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage their spinal, that is back and neck, and joint pains. Now, I give you simple exercises, easy strategies, easy lifestyle changes, hacks, tips, and tricks that you can manage within your existing time. You don't have to take out a chunk of time to do these. And that is how I help you. Now, if you're a working mom, you've been sitting at your desk for a while, it is common to have neck pain across the population. But as working moms, our days are quite stressful, and it is possible that you might have neck pain. Now, imagine when you have neck pain, you're already dealing with one issue, and then you start to have wrist pain or carpal tunnel syndrome. And carpal tunnel syndrome gives tingling numbness, it creates tingling numbness in your fingers. So that's an additional problem. Now, you may be wondering, is it my neck pain which has flared up and is causing this tingling numbness? Or is it that I have carpal tunnel syndrome or wrist issues and that is causing tingling numbness in my hands? So this it sounds trivial, but this can be a big question because you might think of this as your neck pain flaring up, and obviously you don't want your neck issues to flare up, right? Now, when I say neck issues, it could be a disc, osteoarthritis, stenosis. I mean, there are multiple reasons. For you to get tingling numbness in your hands because of your neck. So let's just quickly look at the reason as to, or the mechanism, how your neck pain can translate into tingling numbness in your hands. Now, in our spine, all the way from your neck to lower down till the end of the spine, we have vertebrae stacked on top of each other. There are discs in between these vertebrae, and there are nerves that come out or exit the spine between the two vertebrae at every level of the spine. These nerves go and supply a specific area of the body. For example, the nerves that exit the cervical spine will go and supply the shoulder, arms, forearms, and all the way to the tips of your fingers. Now, if there is an irritation or compression of the nerve, say in the lower cervical spine, these can manifest as tingling numbness in your hands. So it is possible that you get tingling numbness in your hands because of a compression of the nerve within your cervical spine. Now let's look at carpal tunnel syndrome, and then I'll talk about the relation between the two. So carpal tunnel syndrome is basically a problem in the wrist. There are a couple of bones here, and there is a nerve that exits your cervical spine. It's called the median nerve, and it travels all the way down into your wrist, and it supplies your thumb and these two fingers. So basically, these three here are supplied by the median nerve. When your median nerve is irritated or compressed in this area, that is your carpal tunnel, it is known as a carpal tunnel syndrome. It can have multiple reasons. Maybe it's commonly seen in pregnant women because of that excessive fluid retention. So there's a swelling in the area, right? So it can irritate the nerve. Or if you do repetitive work, like say you are working on a keyboard all the while and you're doing this typing, so repetitive action of your fingers, or you're using the mouse on a repetitive movement. Now, if you're looking for more details on what is carpal tunnel syndrome, what is the nerve pain, what is repetitive stress injury, I'm not going to address the details in this video because we'll go above time. But you can go to my YouTube channel and have a look there, or you can just go to YouTube, type my name, Swati Prakash, followed by wrist pain or repetitive stress or nerve pain, with whatever you're looking for, and it'll come up with those videos. So going back to what I was saying, when you have the irritation of the median nerve here, you will get the carpal tunnel syndrome and you will get the tingling numbness. Now, if there are two things, if your median nerve is affected and you have wrist pain and you do have this repetitive kind of work, it is possible that you have carpal tunnel syndrome if the distribution of the tingling numbness or the nerve pain is in your thumb and these two fingers. It is also possible that your median nerve is getting irritated in the neck, but usually, if you do have that wrist pain, the probability is that you will have a carpal tunnel syndrome. Now, I'm not teaching you how to diagnose yourself, but this just gives you an idea when you're discussing with your doctor, or when your doctor will do examination and physical examination and some tests and all, and they'll be able to tell you what's going on. However, um, this is just to put your mind at ease and for you to have a better discussion with your doctor. All right, so this is if it is a localized problem at your wrist. Now, how do you know if your problem is actually related to your neck? With your neck pain, you may have realized that there are some activities that aggravate your neck pain. For example, if I do not take breaks in between my work, and if I'm in a poor posture, if I keep my neck bent over, or I do some weights with my neck in a poor posture, that aggravates my neck pain. In your case, find out what aggravates your neck pain. If activities that aggravate your neck pain also flare up your tingling numbness in the hand, that means most probably the problem is in your neck, and that is the cause of your tingling numbness in the hand or your carpal tunnel syndrome. Now, if the activities that relieve the pain, for example, for me, it's neck stretches and cold packs and hot packs, if that relieves your pain in the neck, and once you have pain relief in your neck, that relieves the pain in your wrist and the tingling numbness in the fingers, that means your tingling numbness in the hand or your carpal tunnel kind of symptoms are actually related to your neck. So you see how when the neck pain flares up or reduces, it also affects your wrist. If it does not, then probably these are two separate issues. Now, if you're looking for more solutions to manage your joint pain, your neck pain, or for that matter, your back pain, I have a free community. I will leave a link in the description of this video. You can join the community. There are quite a few trainings there, one of them being simple solutions to manage your neck pain. So every month we do a free training there, and when you join the community, you have lifetime access to these trainings. Alrighty, I hope that was useful. If you have any questions or comments, please drop them below this video and I will address them for you.